Hello, everyone, and welcome to our Cyber Deep Dive COVID-19 and Other Threats to the Healthcare Sector webcast. For your information, copies of this presentation and the related slides can be found in the handouts within the webinar. As always, before we get started, just a little bit of housekeeping. While the presentation was carefully researched and it does not represent any official positions of Duff and Phelps or Polsinelli, nor it constitutes legal or professional advice. Moving on to who I am, my name is Andreas Chrysostomou. I'm a managing director and the global leader of the healthcare and life sciences industry practice of Duff and Phelps. Today, I'm joined by my colleagues from the cyber risk practice of Kroll, a division of Duff and Phelps, who will perform the cyber operation and dissect the cyber issues faced by the healthcare industry today. Let me introduce them. Keith Wojcieszek is a managing director in the group, and he is joined by Nicole Sette, senior vice president, and Laurie, Iacono, vice president in the group. Today, we are also joined by Bruce Radke, shareholder and co-chair of the Privacy and Cybersecurity practice of Polsinelli, an expert in the field who will reflect how these cyber threats increase the potential for severe legal and regulatory consequences. COVID-19 put so much pressure in businesses and organizations that they had to switch gears and quickly adapt when possible to remote working environment. They need to stay up to date with the pandemic, and the shift to remote work creates tremendous opportunities for cyber criminals, which our speakers will cover in this session. As we move on to the next slide, we can see that the healthcare has been, is, and will be a particular gem in the eyes of cyber criminals. Today's session will highlight why healthcare providers are so often targeted by cyber criminals, how hackers are attempting to monetize their attacks through extortion and in the shady dark web forums, the potential legal and regulatory impact of such threats, and how your organization can better prepare. A study from Cybersecurity Ventures estimated healthcare companies invested over $65 billion, and I repeat, $65 billion towards cybersecurity in the last 5 years alone. Despite this massive investment, the Department of Health and Human Services Office of Civil Rights reports that nearly 47 million Americans have been impacted by a healthcare-related data breach in the last 2 years, with more than half of the breaches coming from healthcare providers. Unfortunately, this trend is poised to continue going up, given the impact of coronavirus is having on providers and is stressing them out. I now turn the presentation over to our experts, Keith and his team, who will dive into specifics on what's going on from a cybersecurity issues in the healthcare space. Keith, the stage is yours.
Thank you, Andreas. I really do appreciate that. Good afternoon, everyone, and thank you for participating in a conversation that has hit the headlines due to the current COVID-19 pandemic. But really, healthcare attacks have been on the top of the list for transnational organized criminals for the past decade. My name is Keith Wojcieszek, and I'm a managing director with Kroll Cyber Risk. I lead the global response for the Cyber Threat Intelligence team, where we collect, analyze the current trends, attack vectors, and cyber incidents that are affecting our daily lives, and utilize our findings to provide more of a strategic and actionable intelligence to assist in preventing and defending these cyber attacks. With the COVID-19 being at the forefront of every media outlet, it really tends to arm these criminals with the ammunition they need to begin attacking vulnerable institutions and different organizations. So, for example, WHO claimed that cyber attacks against them have doubled since early March, utilizing multiple methods for monetary gain. So, to follow that attack on WHO, a potential DDoS attack occurred on HHS, which is a Health and Human Services organization, as well as possible misinformation campaign about the virus on Twitter through HHS. And then as you see right now, to get really bad, these transnational criminals attacked one of the largest COVID-19 testing facilities in the Czech Republic, which forced them to cancel operations, surgeries, and really relocate these new patients to other hospitals. So on the next slide here, Kroll has an ability to see the complete circle of life within cyber attacks. It's extremely beneficial for us. Within the past 5 months, we really have witnessed these transnational organized criminals become increasingly aggressive in their actions during the midst of an attack. Not only are companies suffering from a cyber incident and are on a timer to stop the attack and to save their data, but now these criminals are also pressuring these victim companies to pay the ransom, or they'll have their data exposed on the internet. Now, the group affiliated with the Maze ransomware not only encrypts your data, so you're unable to access it, but then exfiltrates it as part of the attack. Now, at that point, they set this timer that you must pay by a certain day and time, or they'll post it for public download. Now, this data is posted on a website called Maze News, which is frequently updated with several new victims. Now, as we're reviewing this site, we see there may be some hope, though, which is revealing. Which is actually very, very good. So on March 22nd, the Maze Group made an official press release on the website that they said they would stop all activity against healthcare organizations in light of the COVID-19 crisis. So, looking at this, maybe they do have a heart. But unfortunately, as you look on this next slide, the very next day, they updated their Maze news site to include a data dump from vaccine testing facility known to be conducting these COVID-19 research. Now, the facility was attacked prior to this announcement. They're going to stop all activity, but the fact they would publicly post a healthcare organization's data so quickly after the press release really shows the pure intent of these criminals. So this next slide is interesting because during an investigation, Kroll, one of our goals is to identify how the attacker gained the access to the system. Phishing campaigns, everyone talks about it, and really seems a very elementary method of gaining access, but it really is still the most successful. As you see above, exploiting COVID-19 and this pandemic, really, these criminals are utilizing this to compromise any type of network. So the next slide we have here really shows a really grim reality. As I stated earlier, we're able to see the entire circle of life of a cyber attack. With this purview, we can identify the service line, attack vectors, and really other facts surrounding cyber events. So as COVID-19 becomes this launching pad for transnational criminals to monetize during a volatile state of affairs, we really have this case study here that shows, like I said, the grim reality of what can really happen to victims of an attack. So right here on a basic timeline, so ransomware was detected at a medical center where approximately 25 endpoints or devices, computers were really encrypted and deemed unusable. Now, this completely seized the medical center from performing its basic functions. So just kind of imagine how your daily life would be and how impacted it would be if you lost control of all devices, all access to your files, and even the internet for a particular length of time. And we're not talking hours, we're talking days, possibly weeks of not being able to access this. Now, this occurred at a location that is set up to save lives. So this outcome is really not only a grim reality, but completely shocking that these criminals will attack healthcare facilities, especially during a time of crisis. Now, at this point, I'd like to turn over the presentation to one of our today's top leading cyber experts, Senior Vice President at Kroll, Nicole Sette.
Thanks, Keith. So in the next few slides, we'll be discussing Kroll's cyber attack trend statistics. These trends are derived from Kroll's incident response case intakes, which we analyze on a monthly basis to sort of capture attack trends in real time as they're happening. We then feed that trend information back to our clients and also to our practitioners as well, so we can better understand incoming computer intrusions. So I'm going to start off by focusing on the major threat incidents targeting healthcare providers throughout 2019 and then also in the first quarter of 2020. One of the things we'll be highlighting is that while the pandemic has certainly resulted in waves of new types of cyber attacks directed at the healthcare sector, most of the trends we're seeing are really consistent with the targeting patterns we've seen over the last 18 months. namely phishing as the leading attack vector across almost every sector, as well as the targeting of the healthcare sector as one of the single most targeted industries we're seeing in our Kroll cases. And, you know, the important thing here is that email compromise and phishing along with it, as well as the corresponding human element involved in those, has persistently been the leading cause of compromise with our threat incidents we're seeing over the last 18 months. So in the next few slides, we'll review the top threats and vulnerabilities within the healthcare sector, and we'll provide some real-world case examples of cyber intrusions directed at healthcare providers. Next slide, please. So as I mentioned, we can see here in the red that email compromise made up the lion's share of threat incidents targeting the healthcare sector in 2019. The next largest incident type was ransomware, followed by insider threats in the purple and unauthorized access in the light gray color there. Now, while we documented a wide variety of attacks, as you can see here, targeting healthcare in 2019, again, Kroll found that email compromise remained the #1 vector for cyber intrusion, consisting of 44% of Kroll's healthcare intake cases. And while phishing has not changed as the leading attack vector over the years, the phishers' techniques and playbook continually do change. So for instance, last year saw various new and unique techniques as actors continue to evolve to avoid detection and prevention, which we'll discuss in more detail here. Next slide. So as you can see on this bar graph, the hospital systems in the red there are the most frequently targeted subcategory within the healthcare industry based on Kroll's intake cases. Within the hospital category, email compromise was the most observed threat against hospital systems. Well, hospitals are more often targeted because attackers are seeking to compromise the largest amount of victims all in one go. Cyber criminals really only have to compromise one employee's account, which can then be used to infiltrate into entire staff across a hospital to gain potentially access to thousands of other employees. Now, when it comes to ransomware attacks, hospitals are also a more lucrative target as they have this sense of urgency to remain operational at all times, as well as the funds to pay ransom demands. In terms of specialized clinics, which we see highlighted here in blue on this graph, these are orthopedics, chronic care, cosmetic surgery, etc. Now, this is the most second frequently targeted discipline within the healthcare industry based on our case intake. Within this category, ransomware attacks were actually the most observed threat against specialized clinics. Kroll assesses these organizations are more prone to ransomware attacks because they're more likely to rely on outsourced IT vendors or managed service providers to manage their corporate networks. And as we'll discuss later in the presentation, we've really seen in 2019 an increase in threat actors compromising managed service providers to get to their client base, especially with ransomware. So that's one of the reasoning elements there behind the ransomware targeting these specialized clinics. Some of the other elements in the graph here are things like medical device companies. Now, with a company like that, ransomware and maybe wire fraud aren't quite as popular. However, some of these companies deal with things like cyber espionage attempts through advanced persistent threat attacks, where actors may be coming in, persistently waiting on the network, and exfiltrating intellectual property based on those medical devices. Next slide, please. So we talked about 2019 trends, and the story here in Q1 2020 with this chart is that we still see email compromise as the most common threat impacting healthcare networks. It's here in the red. As we heard earlier, actors are really now with COVID trying to leverage these PPE shortages, the news cycle about COVID, to really try and trick victims into wiring money into fraudulent bank accounts, and to leverage that sense of urgency to get users to click on phishing emails. So email compromise still big in Q1 2020. All that being said, in Q1, in terms of attacks against healthcare providers, there's been a notable increase in unauthorized access attacks against healthcare, seen here in the purple. A lot of this is based off of highly publicized VPN and remote access vulnerabilities within healthcare networks. So we saw unauthorized access, that purple piece of the pie chart, increase from 10% in 2019 to 24% in this first quarter of 2020. So essentially, we're seeing a little bit less phishing and more scanning, proactive scanning of networks by attackers to identify weak points associated with remote access software and VPN appliances. So again, here, the notable trend in 2020 so far is this targeting of remote access software, and we'll be talking about that a little more later in the presentation when we focus on Citrix vulnerabilities. At this point, I'm going to turn it over to Bruce, and he's going to discuss a little bit about the legal and regulatory landscape.
Nikki, thank you so much. And so if you do have an incident breach and you need to notify affected individuals, you may also have to notify state AGs and HHS. And depending upon the nature and the size of the incident, state regulators may institute an investigation. And the nature and kind of the scope of that incident varies from state to state, and obviously based upon the nature of the incident itself. So for example, in Massachusetts, when you notify the Massachusetts AG, part of that notification requires you to state whether or not your organization has implemented a WISP, a Written Information Security Plan. Under Massachusetts law, it requires organizations that own or license personal information of Massachusetts residents to implement a WISP. So this very well may have an extraterritorial effect in the sense that you may be, a New Jersey healthcare organization that have patients in Massachusetts, or your patients may have moved to Massachusetts. And when you do have an incident, you may need to notify the Massachusetts AG, and you're going to get the question about the WISP. If you say no, Massachusetts will, start an investigation in terms of a WISP. So, long story short is to avoid that potential problem if and when you do have an incident. If you do have a presence in Massachusetts, you conduct business in Massachusetts, or you may have individuals, patients in Massachusetts, certainly implement a WISP now before an incident. Indiana and New York and a few other states are somewhat aggressive in providing investigations. So for Indiana and New York, if you have one Indiana resident or one New York resident that you're notifying, you will have to notify those states' AGs. Indiana, and particularly as it relates to healthcare organizations, will undoubtedly institute an investigation, and it's almost a mini OCR investigation, which I'll talk about a little bit before. And they will ask you questions not only about the incident, the root cause of the incident, who you've notified, but also what safeguards that were in place prior to the incident to prevent that from happening. So ultimately what may happen is you may have parallel state AG investigations ongoing, as well as investigations being conducted by OCR, Office of Civil Rights, and the FTC. In the case with Indiana, we have been successful when we do have OCR investigations asking generally the same questions, asking the Indiana AG's office to defer their investigation pending the OCR investigation. That might be helpful. With regard to the FTC, they have entered into numerous settlements with organizations that have had data breaches, but also they have been very much focused upon the types of representations in publicly facing privacy policies around what security measures and precautions that you have in place. That's been a particular area of focus for the FTC. And again, this is kind of a self-inflicted wound that you can certainly avoid. So the recommendation is to go and look at your privacy policies and ensure that the statements that you're making with regard to your cybersecurity safeguards are accurate, and they don't overstate what those safeguards are. and are clear enough such that they cannot be misconstrued by a regulator. Next slide, please. So as I mentioned before, so if you do have to notify 500 or more individuals in OCR, OCR will almost automatically institute an investigation. And that investigation involves not only the incident itself, but also your HIPAA compliance practices writ large. So it's basically an opportunity for OCR to look at HIPAA compliance generally. Next slide, please. And there's a couple areas of particular focus that OCR has that we've seen constantly come up, and let me focus on two of those: the risk analysis and risk management plan. And I think that until you go through an OCR investigation, I think a lot of entities, healthcare entities, believe that they've conducted an adequate risk assessment and risk management plan. Unfortunately, probably less than a quarter of the entities that we are working with really do have done a compliant risk analysis and have a risk management plan. Typically what they've done is they've conducted a gap analysis. So what they will do is they will go through the regulations, the physical, administrative, technical safeguards, and they will basically check to see each one of those regulations if they have certain types of policies. So for example, they will check to see if they've done employee security awareness and training. Check. Do we have access control policy? Check. And that's the extent of their risk analysis, or what they believe is a risk analysis. But unfortunately, that is not what the regulations require you. Basically, what the regulations require you to do is identify what PHI that your organization holds, where does that PHI where is it maintained, and what are the risks associated with that PHI in those various places, and then develop a risk management plan to address those risks. And as I mentioned, a lot of folks believe they have done this, but in fact they haven't. And again, probably less than a quarter of the folks that we've been dealing with really have a sufficient plan. The other thing that OCR has been focusing on is business associate agreements with your various vendors. So again, go back, and I know it's very challenging for large healthcare organizations with multiple vendors, but just double check as part of your program to make for sure that you have BAs with all those various vendors, and particularly now, given the COVID-19 situation when we're reaching out to, kind of telehealth, ensure that we have been entering into those BAs to ensure that both compliance and legal and the technical side of the house are working together, ensuring that we've dotted our I's and crossed our T's and gotten those BAs. A couple other things to note here. Given the circumstances dealing with COVID-19, HSS OCR has issued kind of notices of enforcement for non-compliance of the HIPAA rules. And basically, they have stated that they will not enforce the HIPAA rules as strictly if there has been good faith compliance. Apologies to the unmitigated plug here, but all those notices are posted on the Polsinelli COVID-19 blog, so you can go and kind of look to see what what are those those notices. Secondly, what we've also seen with regard to OCR investigations, there has been a very strong uptick in the last 2 to 3 weeks of OCR investigations that have been pending for a considerable amount of time, that the investigators are looking to get those matters concluded by the end of this month. So if you may have had an ongoing OCR investigation that has been pending for some time, you may want to reach out to an investigator to see if there's any additional information that they may need to close that investigation. Next slide, please. So in addition, if you do have a breach, you may be subject to liability under the California CCPA. So the CCPA provides plaintiffs with a private right of action that allows plaintiffs to recover statutory damages for data breaches, even when there's no harm shown. And the damages range from $100 to $750 per consumer per incident. So as you can imagine, if you do have an incident with 100,000 people, that those damages may accumulate very, very quickly. And in the past, it has been difficult for plaintiffs and class action attorneys to show injury and to certify a class when there hasn't been any actual harm to the plaintiffs. But what the impact of the CCPA is, it will be easier to establish injury and get over the standing hurdles. So I think what we'll probably be seeing is increased class actions being filed, and also increased amounts of settlement cost. Next slide, thank you.
So I'll jump in here. Now we're going to pivot back to email compromise here. And this slide is showing Q1 2020 email compromise by infection vector, which primarily here is phishing. We're talking about phishing. So Q1 ended before we really started to see the massive increase in COVID-related phishing emails. But even so, these scams were already on the rise by the end of March, with COVID-related phishing scams making up 6%, seen here in the blue, of overall phishing incidents, which is significant given that's for the entire quarter. So some newer techniques that are being used in phishing, as we saw toward the end of 2019, include things like vishing, which is voicemail phishing, thread hijacking, which is a way that attackers can insert themselves into a pre-existing email thread so that their phishing emails seem much more legitimate for a user to click on. Things like malicious survey attachments, which all of us receive on a regular basis and generally are very quick to click on those things. As well as something we saw in 2019 was two-factor authentication compromises via social engineering attempts. And so most of these things are going to continue into 2020 and possibly with a COVID spin on them. I also wanted to bring up a report that was recently released by Google, which most of you probably have seen, where Google saw over 18 million COVID-related phishing and malware emails in 1 week, which is pretty amazing. But again, as Google pointed out about this, these threats aren't new, but rather it's just existing malware campaigns updated to exploit these fears and confusion surrounding COVID. Next slide, please. Thanks. So here we have a typical case study on a phishing incident, which most of you have seen before, I'm sure, but we wanted to share this because it's sort of a real world example involving the healthcare. So in step one here, we have a hospital employee click on a malicious link, and then their email is compromised and a bad actor gains access to that account. In step two, an email spoofing the CEO is then sent to 1,200 other employees from that compromised account, requesting the employees sign in using corporate credentials to complete a survey. There's the survey. And then now step three, the end game, right? 4 doctors had paychecks rerouted with losses totaling in the tens of thousands of dollars. So looking at this first step in red here, it's important to point out that phishing attempts, as I said, rely on creating this sense of urgency that's pressuring the targeted individual to click on that link, to transfer the funds or edit the banking information so that the attacker can get in and swiftly carry out the fraud. And again, we've talked about COVID in that lens, making this more important to recognize. These scams often involve some big transactions or even confidential matters related to management. So those are things to look out for. And then as we move on and look to steps 2 and 3 here in the phishing journey, it's important to point out, Kroll recommends clients really ensure mechanisms are in place to validate these wire transfer requests before action is taken, such as using dual verification procedures. Two-person verification can go a long way in preventing some of the wire fraud incidents that we see using phishing, or predefined escalation protocol. So in the case of payroll, you need to get other, holistically get other elements of the practice involved, HR and finance, before some of these operations are carried out. And then also just building a security culture goes such a long way, a culture that trains individuals to always second guess embedded links and attachments. It's kind of funny here at Kroll, where we do security, cybersecurity all day long. It's really difficult for management, I think, sometimes to get us to do our trainings or complete a survey, because we're also paranoid about clicking on any links. They have to tell us 3 or 4 times, no, really, it's legitimate. You can click on it. So that security culture, that employee culture is really important when we're talking about email compromise and phishing. I'm going to turn it right back over to Bruce here to talk a little bit more about fraudulent wire transfers and unauthorized access.
Great. Nikki, thank you. And kind of to follow up on Nikki's point, I'm amazed by how quickly the threat actors have adjusted their email phishing campaigns to take advantage of the COVID-19 crisis to engage in financial crimes. We see a number of examples of, threat actors have, used compromised accounts to request vendors to, move payments from one account to the account by the threat actors, with the notion that the change is being requested due to COVID-19 quarantine processes and precautions. We've also seen a rapid increase in the number of business email compromises that are targeting municipalities and healthcare organizations that are attempting to purchase PPE and other supplies to fight the COVID-19. And lastly, we're now seeing emails put out by the threat actors referencing the federal stimulus payments and the SBA loan program. So just be on the lookout for those, because those are ongoing. So when an organization has an email compromise, as Nikki said, those are typically focused on engaging in financial crimes such as wire fraud or fraudulent wire transfers. But depending upon the number and the nature of the connections in the compromised account, it is possible that the entire content of that email account may be considered at risk and compromised. And if so, you may need to notify the affected individuals, the individuals whose sensitive information is in that account, as well as the regulators and other folks. Also, there may be contractual obligations that may be triggered if, in fact, you have an email compromise and a business partner's information is in those accounts. So, for example, if you're a business associate and you have a covered entity's patient information in one of your employees' account that's been compromised, you very well may need, not only under HIPAA, but also under contractual relationships, to notify those folks. So you need to look at those regulations. In terms of one of the questions that always comes up, and literally I was just on the phone earlier this morning about this particular incident. If you have an email compromise and there's been a misdirected wire payment, who's responsible for that? Is it the company that has had their email account compromised and that account has been used to send fraudulent wire transfers to another company that relied upon those fraudulent wire transfer instructions to put the payment over to the threat actors? And long story short is, although lawsuits have been initiated, the case law in terms of assigning responsibility is ongoing. But generally, you try to, there's a couple factors to look at in terms of assessing relative culpability. And from the organization who's had their email account compromised, you would look at what pre-existing safeguards do they have in place to prevent that from happening. And as Nikki said, have you implemented multi-factor authentication? That's one big one. And two, what type of employee training have you instituted to alert folks to know they should be aware of this? On the flip side, for the recipient side, assigning culpability may depend upon, is there any red flags that would cause you to question a change in wire instructions? So if you've had multiple payments being made to Bank of America over time, and you get a change in wire instructions to some other account, that may cause you to question the change. And as Nikki said, which is a great recommendation, is pick up the phone, call and verify that change in instructions. So let me turn it over to Laurie with regard to Citrix exploits. Laurie?
I'm going to pick this one up as well, Bruce. Thank you. I'm going to just wrap up here with the unauthorized access. So we thoroughly, thanks for that, Bruce. We already thoroughly examined threat incidents related to email compromise. And now we're going to take a closer look at incidents related to unauthorized access attacks against the healthcare sector. So as I mentioned earlier, we did see an uptick in unauthorized access in Q1 of 2020. Now, a big reason Kroll assesses for the increase in this category is a critical vulnerability involving Citrix software that was first detected in December of 2019. This vulnerability involves Citrix products used in secure remote access and load balancing. And so the exploit essentially allows threat actors to gain access to a company's network and remotely execute code. And now, even though this was announced in December and patched, there are still thousands of servers that are unpatched and exposed. And with persistent vulnerabilities like this, where there are exploits available, sometimes it's the most overstretched IT teams or overworked security teams that are vulnerable to these types of exploits. So think hospitals during the COVID crisis, right? At a time where we're overstretched and overwhelmed, it's very difficult to carry out some of these patches and mitigations that need to be done in a step-by-step way. Next slide, please. So we have a case study here involving the Citrix vulnerability. Simply put, a healthcare company was notified about the vulnerability in January. The company discovered a compromise when they were making efforts to resolve that, and they contacted Kroll. And through our forensics, we discovered that malicious actors had, in fact, run commands within the network to schedule a periodic data exfiltration from that network. So now all this happened despite a proactive notification from the vendor. So you can imagine what's happening out there in networks that haven't been analyzed or haven't been tipped off to this activity. Now, of the Citrix network compromises we observed in January, Kroll, 50% of those concerned healthcare-related organizations. And also, according to open source reporting, the healthcare sector is the second largest industry segment to utilize certain Citrix apps. So you can see where the large volume of healthcare providers employing Citrix applications makes this industry particularly susceptible to the recent vulnerability. So the important thing about this vulnerability is that according to DHS, compromised systems can't be remediated by applying the patch that was released for this. So if you've already been compromised, applying the patch won't work. In other words, once a threat actor establishes a foothold on an affected device, their presence will remain even if the original attack vector has been closed. So that's sort of a really important thing to point out here. And it's a reason for vigilance when you're investigating these incidents. Industries even reported that attackers are getting in and installing the mitigations for the Citrix vulnerability to essentially make it look like it's been patched and keep out other attackers while maintaining their own backdoors. So in terms of Citrix, really important to keep up with the literature that's out there on this. Citrix has scanning tools available for this vulnerability. The National Security Agency and DHS have released tools with additional detection measures. So just a really important awareness here with the remote access software and the Citrix vulnerability in terms of unauthorized access. So at this point, I'm going to turn it over to Laurie Iacono, who's going to discuss malware and ransomware in more depth.
Okay, thanks for the introduction, Nikki. So this slide, earlier in the presentation, Nikki had alluded to the fact that malware was the second biggest threat to the healthcare sector. And this is just a breakdown of the malware types that we saw impacting healthcare in the first quarter of 2020. And as you can see, that big red piece of the pie there is ransomware. And when you combine that with another 5% that is a co-infection of ransomware and a Trojan, you see that ransomware cases account for more than 3/4 of all malware attacks against the healthcare sector. When we did some additional analysis into the ransomware cases impacting the healthcare sector in the first quarter, what we found was a little bit scary in light of the coronavirus, because most of the points of compromise for these ransomware cases were what we would consider a remote work vulnerability. So things such as compromised credentials for a remote desktop instance that would allow a hijacker to get into it, remote application exploits such as the Citrix exploit, which Nikki just explored, and also VPN vulnerabilities like the Polsinelli VPN. And this is probably why Microsoft just a couple of weeks ago issued, I think it was kind of a first of its kind, a warning to hospitals specifically to patch for these vulnerabilities. And as I said, us kind of looking into it further underscores that these remote vulnerabilities are a leading vector of these ransomware attacks. Now, I want to talk a little bit about ransomware in general, because we have seen so much movement in that particular landscape over the past year. We look every month at our incident response cases at Kroll. And last year, we identified, beginning in May 2019, we started to see an uptick in ransomware cases every month. And by the end of 2019, ransomware cases had nearly quadrupled for our month-to-month caseload. At the same time that we were experiencing this increase in numbers, we were also seeing just in the general ransomware landscape that there were a lot of changes and evolution of the tactics, techniques, and procedures that these threat actors were using. So if we look at our next slide, we actually have a case study of a Sodinokibi ransomware case. And Sodinokibi is one of the new ransomware variants that emerged in the middle of 2019, and it became one of the most dominant ones that we see. It's also one of the most hardest variant names to pronounce, I will say that. So this is a good case study, though, of some of the changes that we have seen in these TTPs. So Nick, you mentioned earlier that one of the things we've seen is this targeted attacks where they're going after a third-party provider, such as a managed service provider, that can spread a ransomware across their clients. In this case, we had that happen, that an MSP was compromised, and then they began spreading Sodinokibi to their clients. One of the networks one of the clients that was actually encrypted as part of this attack was a healthcare provider. And at this point, the healthcare provider, it was a surgeon, was locked out of all their patient electronic health records. So it's very similar to that attack that Keith outlined at the beginning of the webinar, where, just imagine, you have a life and death situation and the doctors can't even get to the health records or even communicate with each other over email. Now, step 3 here, the ransom and extortion. This is one of the new things that we have seen in the ransomware landscape. It really started in earnest in Q4 of 2019, but attackers started adding an exfiltration component to their attacks. And then that wasn't good enough. Then they started posting what we call shaming sites, as the one Keith showed earlier, Maze News, where they will actually post the exfiltrated data if the victims don't pay their ransom. So essentially, even if you had gotten to step 2, let's say you had good backups and you were able to restore your network and minimize the damage of the attack, now the attackers have your data. So they still are going to pressure people to try to pay the ransom, threatening to put the data up there on a website. So now healthcare providers are faced with the fact of, do we pay the ransom, or if it goes to the shaming site, now they're facing, violations of HIPAA, as well as, patient exposure and the brand reputation of that. Now, along with this increase in ransomware attacks, we've also seen an increase in the price of an average ransom demand. And one of the statistics I looked at recently said that I think it was in Q4 2019, the average ransom price was about $84,000. And that was actually double what the average ransomware price was in Q4 of 2018. So, Bruce, I'm going to ask you if you could speak to what you're seeing at Polsinelli as far as ransom prices.
Yeah, and Laurie, a couple things, right? So we've also seen a steady increase in the amount of ransom demands. We've had one, as it shows here, $18 million that ultimately got negotiated down to $6 million. So the demands and the payments are very high. One other thing I want to kind of pick up on something that Keith had mentioned earlier about the Maze Group kind of standing down in terms of targeting healthcare organizations. Unfortunately, that is not consistent across the threat actor community. Literally just this weekend, we're working with 2 hospitals, healthcare systems that got hit with Ryuk ransomware. And we had in negotiating with the threat actor in negotiating the cost of the ransom payments, we had made mention to them, or another third party that we utilize, that it was a healthcare organization. They were in the process of dealing with COVID-19. And long story short, the folks who were doing the Ryuk attack said, sorry, we're not interested. It had no impact whatsoever in terms of the payment, and they still demanded the payment. So, Laurie? Yeah, maybe next slide, please. So in terms of what does ransomware mean in terms of kind of your legal obligations? And, traditionally, we saw ransomware attacks that may have encrypted data, but we didn't see any sign of any access or acquisition. So for those types of incidents, we really didn't see a whole lot of notification. So I think that the number of ransom attacks were grossly underreported. And as Laurie mentioned and Keith mentioned, we're now seeing that the threat actor strategies have evolved. So we have this, the shaming and posting of information, and to the extent that information has gone outside your organization, just want to let you know that has been an unauthorized acquisition of information, and even if you may pay the extortion demand to take that information down from the Maze site, for example, because there has been an unauthorized acquisition, you will have to notify those affected individuals. So, consider that as you're thinking about, whether or not you want to make that extortion payment or not. As it relates to the requirements for notification under the OCR ransom guidance that came out in 2005, OCR takes a position that if you have a ransomware attack that encrypts data, that is considered that the data there's been an unauthorized acquisition of that data. And therefore, there is a presumption that you have to notify affected individuals unless you can demonstrate that there's been a low probability of compromise based upon things like, do we see, what's the nature of the ransom of the malware? Does it have the ability to exfil data outside the organization? How widely spread has the infection occurred? Do we see any actual exfil of data outside of the systems? And then 2, what impact does the attack have on ongoing or current patient care? So all those factors will come into play as to whether or not notification needs to be provided. And let me turn it back over to the Kroll team to talk about the dark web landscape. Guys?
Okay, thanks, Bruce. So the next few slides are looking at chatter that we see in the dark web related to healthcare data. The quote here from the FBI Cyber Division is talking about the average price of healthcare data on the black market, comparing it to a stolen social security number, a credit card number. For $1, healthcare data goes for $50 on the black market. And one of the questions that we sometimes get is, why is healthcare data so much more valuable? And there's really the main or the biggest reason for that is because obviously healthcare, they have a huge breadth of information. So they may have the traditional social security number, date of birth, financial information that would help threat actors commit standard identity theft. But with the patient records, you know, diagnoses, things such as medications, health insurance information, this kind of data also enables threat actors to commit other types of fraud, such as health insurance claims fraud, health savings account fraud. It can help them craft a very, very targeted phishing lure, let's say to an individual or a group of individuals that has a certain diagnosis and thinks that that's something to click on, and then they deliver the malicious link that way. We also see this kind of data used for extortion. Going back to the ransomware extortion that we talked about, we have seen cases where if the provider won't pay the ransomware gangs will actually go after the individual patient, and they'll threaten to post things like their before pictures from plastic surgery or pictures that would reveal illegal drug use. So we've actually seen that from the threat actor base. Now, if we want to go through the next couple of slides, I see we're coming up, getting close to the hour, so I'll go quickly through these next two. But the next two slides here, if we want to go to the next one, they're actually just actors offering access to different healthcare providers on different dark web forums. One of them was advertising admin level access. It sounds like they had a username and a password. This one here is actually advertising access to a multi-million-dollar healthcare company. It says that you can get to the server, and from that server, you may be able to pivot into their customer list and remotely exploit their customers. Now, if we go to the next slide here, this is a listing from a credential shop known as Genesis Market. And Genesis Market is essentially, it's a market where you can buy a compromised computer to commit fraud. And when you buy that compromised computer, you get all the saved passwords on that computer. And in this particular instance, we found several listings on Genesis where there were login and password credentials for health insurance providers or portals where the patient may look at their records. And this would give any buyer of that protected health information as well as any stored payment information that was there. And if any of you are following the recent ransomware attack on Cognizant, Genesis has kind of come up by many researchers as speculation of a potential source for attack because there are a lot of listings on Genesis for Cognizant accounts. If we go to the next slide here, this is another listing that we found in a marketplace. And this one is for a database list of over 100 or over 500 individuals. And the really interesting thing that we found about this particular listing was the author of it said that they were a data analyst and had accessed this. So it may be indicative of insider threat. Obviously, we've redacted the names of all the impacted companies, but this is, this would be obviously of interest to a company that was being named in this way on the dark web. Now, as far as Kroll and the dark web, we do help with proactive dark web monitoring for clients to help try to prevent and mitigate against the risk of such chatter. And our team also works very closely with incident response practitioners when they're actually having an incident to try to either look for possible data that was exfiltrated or look for clues as to how a certain user may have been compromised. Another question that we sometimes get about the dark web is what are the legal implications of knowing what's out there? Some people feel like ignorance is bliss. But Bruce, can you speak at all about that from the perspective of counsel?
Yeah, Laurie, great question. And sometimes, yes, ignorance is bliss. You do have to provide notification if there has been an unauthorized, if you're aware that there has been an unauthorized disclosure or acquisition of your data. but I think a lot of folks kind of weigh that risk of knowing what's potentially out there and addressing some of the issues that may arise, knowing that information is out there, separate and apart from just simply providing notification to those individuals. Laurie?
So this is Keith again. So this slide is really interesting because it talks about beware. Hey, 7 times we hit by ransomware. This is the only time it's hit our backups. Interesting for several reasons. The fact that they've been hit by ransomware 7 times, again, is extremely interesting and very relevant. Having talked to these criminals, interrogated them in the past, they are very persistent. And not only are they persistent, they up their game every time, and they're communicating. They're letting you know, hey, this system does have vulnerabilities. They do talk. It's not just one individual. These are groups of people that go and talk about what they've hit and where they've gone, and maybe certain vulnerabilities that Nikki, Laurie, Bruce, everyone has described in the past. So next slide, Leo. So after going through all the reality of a cyber attack, the question that should come to mind at this point is, how do I not become a victim? And the answer to that is really just prepare, and just keep on preparing. As an organization, there are steps you should take to improve your cybersecurity posture for sure. And on this slide, there are several recommendations how you can become more mature in the area of cybersecurity. This is not all inclusive, of course, but it's extremely important to begin implementing. On the top of this list, you see updating and testing your incident response plan. This really is imperative. The minimal time between detecting an incident on your network and responding to it, really, the more successful you become, you're able to defend better. That minimal time is imperative to make sure that you recognize it and really go after it as soon as you can. Now, on one other thing that's not on this list, but is extremely important, depending on your framework, is looking at all the devices that are on your network. If you don't know it, you're not auditing your network and your endpoints and all the responsibilities, it could really be catastrophic. Bruce, I'm going to hand it over to you for some type of legal recommendations and see what we can do from there.
Yeah, and really briefly, and there's some great recommendations that the Kroll team has put together. One of the things to just consider, if you have an incident, as Keith mentioned, what do we do? And responding quickly, take your incident response plan, do your traditional tabletops, and then also think about reaching out to your forensic firm like Kroll or legal counsel in advance of an incident. It's a great time to negotiate those terms and conditions, those MSAs, those engagement letters. And again, if you do get or dealing with an incident, it's just one less thing that you need to deal with when you're trying to put the fire that when the house is on fire. And secondly, candidly, you're in a much better position leverage-wise to negotiate those terms and conditions with the law firms and other providers when you don't have a need. The other thing that I recommend is reach out to those folks, maybe have a call with them to just understand, we have an incident, what do we do? And kind of working with the forensic team and the law firm, how is that team going to react? Keith, turn it back to you.
Yeah, thank you very much, Bruce. I'm actually going to turn it right over. I guess we can hit this real quick, but the biggest thing that everyone kind of needs to understand at this point is you could have all of the technical preparation, technical solutions in place, but if you're not training your staff on a regular basis, that's an issue. Especially now with the staff working from home, it's really difficult for someone to lean over and say, hey, did you get this email too? And just have that communication back and forth. On top of that, letting everybody know the risks that you are facing and informing them on a regular basis is imperative, really to promote the growth of your employees to identify some of these cyber risks. We covered several topics here and, went from top to bottom when it comes to threats from, ransomware to the dark web and all the experts on the phone here. I'm going to turn this over to Andreas just to kind of close everything up and maybe answer a couple questions that we have. So again, on behalf of everyone from Kroll, I just really want to say thank you so much. And Duff, Phelps, and Polsinelli, thank you very much. So Andreas, back to you.
Well, thank you all for the excellent insight on the cyber security issues that the healthcare industry is facing these days, given COVID-19 and everything else that is going on. I know that we're running up on time, but there were a few questions that they came in, and I will pose them to the panel. But maybe the first one may be a bit more appropriate for Bruce to respond. The question that came in is, how much does insurance help when it comes to covering ransomware cost? And I don't know if you have seen it as part of some of the cases that you have worked on.
Yeah, I think it covers and is very beneficial in two ways. Number one is, depending upon the policy, it is very well that the policy will cover the ransom payment. The other part is of the providers that the insurance policy offers to you. So a lot of times those policies will have folks on their panel like Kroll, like a Malware or some other provider to negotiate ransom payments on your behalf and also help you through and deal with the ransom itself. So, Andreas?
Thank you, Bruce. The next question that came through, it's of course, what we have seen on COVID-19 and how it impacts hospitals, with a number of hospitals now investing in telehealth, and it was kind of almost mandated even by the CARE Act that telehealth is one of the areas that the government would like to push through to assist in the current situation and in the future. So the question is, considering this type of investments, when a hospital is looking into telehealth, what should be thinking about the security issues and how should they be addressing it? And I don't know, Nicole, if this is something on your area or any of the other panelists, by the way.
Sure, I can start that off. I think it's really that end-to-end security, and they need to be really investigating, the communication security, but also something I think they need to think about is the accessibility, because even if you pick the most secure communication platform for telehealth available, if you're sort of in the midst of this COVID crisis and someone doesn't have the capability to say put that app on their phone, or if you're using something that's only available say on an iPhone and the individual doesn't have that, then they might revert to something with even poorer security. So I think that's just something to throw out there as this is all unraveling so quickly. That's just sort of anecdotally one of the things that I've heard where telehealth had been set up and the customer didn't have the application available to have that secure chat. So I'll leave it open to anybody else here to comment on that.
Yeah, Nicole, this is Keith. I think you're spot on. It all develops into certain areas, kind of going back to what we talked about preparation. On the business side of it, you need to make sure that you're prepared to offer this solution and really encrypt it and do what you can to secure this communication, because you're talking about very sensitive information. Now, on the user side or the consumer side, that's a very difficult to manage because they're individuals. They may not understand the security features available. So you make sure that when you do this and they alert their individuals that this telehealth is mandated or moving forward, that it's going to be very pronounced. You need to make sure that they have recommendations. Hey, this is what you need for basic security for us to have this secure conversation. So I think it's up to both ends to communicate back and forth to how to move forward to be more secure in their environment. It's very simple practices. It's going back to the 80-20, just understanding what you're getting yourself into and the communications that are having. If it does not need to be said over that communication method, then don't say it. That's another thing that you can also think of. So there's all different aspects of it, but I'll open up to anyone else that has any other recommendations.
Well, thank you, Nicole, Nikki, and thank you, Keith, for the response. I'm looking into any other questions, and apparently there are no more questions. Seem like you guys have done an excellent job walking everybody through these particular issues. And by all means, to the audience, please feel free to reach out to us. We're here to answer your questions, above all to help as part of the situation that is we are all currently facing. So thank you again for participating. To the panelists, thank you to the audience for attending, and we look forward for the future events on cybersecurity and related issues. Thank you all.
Thank you.
Be safe.